All right. Thank you everyone for joining us today. Before we do commence, I'd just like to acknowledge the land in which we're meeting here today and to pay respects to elders past, present and emerging. We've decided to mix things up a little bit today and move to a lunchtime webinar, the first time in 2.5 years that we've been running these webinars for. We had some really strong feedback. People love watching these after in the recorded space, and they are available online on the Adelaide PHN YouTube channel. We do send out links. But we were conscious as well that we had some strong feedback. People, would there be an opportunity for a daytime session? So here we are, and grateful that we can have coffee with us rather than our peppermint teas, as people often see me drink my peppermint tea in these evening webinars. So thank you everyone for joining us today. We've got a number of key updates that we will be running through, and two fabulous presenters with us. We have Dr. Jenni Goold, who many of you know Jenni, who's the medical lead of our COVID high risk hub here in SA Health and has been essentially leading virtual care for GPs for the last 2.5 years. And then we have Simon Adamek here from SA Pathology. Many of you would know Simon. He's the Manager for Marketing, Business Development and Consumer Engagement at SA Pathology. And Simon's going to run through where things are up to currently with some of the iPath systems, and particularly important with the transition across to referral testing from the 9th of January. So let's begin, and I'll start first of all, go through a few key updates. As usual, please post questions in the Q&A box. We do prefer the Q&A box because then we keep a record. If there's particular things, we'll then send that out as part of our weekly updates as well. And as always, we're here to be supportive. We want this to be interactive. So please, anything at all, ask us as we move through, and then I'll be asking Jenni some questions as well. And we've got Amelia for support in the background as well, particularly around some of the more tricky questions with the Q&A. Okay, so let's begin. So I've got seven updates I wanted to make today. So we'll keep this to point. The first we want to talk through is around the current COVID community services. What's available, what isn't available in the future. Then I want to talk a bit about the GPRCs. What's the future of GPRCs? What happens over Christmas? Where do I go if I have respiratory symptoms? Then we're going to talk about the flu vaccine. You're probably thinking, why is Emily talking about the flu vaccine when we're out of winter? But I'll tell you why in a moment. Changes to community care. I'm going to talk about what a virtual care service is, what's adult virtual care, what's paediatric or child virtual care service. We're going to talk about vaccine reminders. Where can you get your COVID vaccine? What's happening with the new Pfizer vaccine coming out in 2 weeks? Talk about the testing changes, a little bit about the current rat availability, 5 free rats. And then I'm going to mention at the end a bit about urgent care centres and priority care clinics, priority care centres, because we're getting quite a number of inquiries coming through around what's happening in that space and what support can they be providing for my patient when I can't see them because I'm so busy and I'm so fully booked in my clinic. So they're the 7 areas we're going to go through. Then we're going to progress to Jenni, and she's going to provide us an update where things are happening in the hub. What can you do when you've got a patient with you? How do you assess them? Some tips and tricks around the antivirals, because again, we know so important, over 70s, having access to antiviral treatment early with that treatment plan before they test positive. And then we're going to then come to Simon at the end to give us a bit of an update around where things are at with SA Pathology, and particularly some of the iPath ordering. Because I think we forget you can order through iPath, and that goes directly then to those testing sites. So Simon's going to give us a bit of an update as we move through. And then finally, I'm going to come to a very big thank you to Adelaide PHN, because again, we've been doing these webinars now for more than 2.5 years, and we're very grateful for all the support that the PHN do provide in enabling us to do this work, but also in supporting a number of community programs. So we'll come to that at the end. Okay, so let's start with current community services for COVID-19. So we've had a few changes that have come into effect. We know that there were changes that came in October that removed those isolation requirements. Now with that we did notice then a change in how people were seeking care from our COVID community hub. So at the moment we have a team within SA Health that Jenni leads, whereby calls come through for people who are high risk, and we have a clinician advice line. Now the clinician advice line 7 days a week, 8 AM to 8 PM to support around prescribing, but also in navigating care. Now, that team, in this coming changes that we're going to be seeing, that team will be ceasing operations on the 14th of December, so in 2 weeks' time, and functions that have been provided whereby people call up the National Coronavirus Helpline or they call up the clinician advice line for their patients. That service is moving to the adult virtual care service down at Tonsley, which is run by the department, but through Salem Clinical Governance. So I'm going to talk a little bit about that as we move through. The other aspects, we know that there have been the changes around the mask mandates, and particularly around mandatory mask mandates. We've heard very strong feedback from GPs that they're keeping their mask mandates in place for their patients and for their staff as well. So we would encourage you, if you are concerned or you're worried about, what do I do? We're in this difficult phase. We've got some great advice we can send out via our GP liaison email, particularly around what signage you can put up or different ways that you can work around health, work and safety requirements to keep your staff and your patients safe. We're going to see more and more that people are going to continue to come into general practice and come into other healthcare settings who are COVID positive. And you simply will not be able to screen out those patients. They may be coming in because they're seeking healthcare, not just as a visitor or not coming in for another reason. So we want to try and keep everyone as safe as possible and reduce the risk that it has on our workforce and getting sick and not being able to provide services. So let us know if we can help you at all with some of those policies. We know that Danny Byrne wrote a really great piece that we then sent out around masks that he's been utilising at Chandler's Hill. So we're happy to send out some of that information as well. The other area I wanted to mention about COVID community pathways is around some of the work that we've been doing around antiviral access. Now, we have one COVID care centre, just the one COVID care centre, and a very big thank you to Central Adelaide, who run that site at Sefton Park. It's 7 days a week. And many of you know Jackie. Jackie Yu has been coming to our webinars and presenting. Jackie is still overseeing that service. They're providing really important first doses for remdesivir, but also assessments for people who are COVID positive. It's a referral-only service and it will be open over Christmas. People said, what's going to happen to COVID care? So that site, they have confirmed, will be open over Christmas. So you can refer your patients into that service if they need an assessment. You are worried about them. Potentially they're on a NOAC and you're worried they're going to deteriorate. And you think, oh, I can't prescribe them Paxlovid. So you refer them into that centre and they can have access to remdesivir. And then we know 3 doses for remdesivir. They can then get the 2nd and the 3rd dose at home if eligible through My Home Hospital. And Carlin COVID Care Centre, they'll organise all of that for your patients. So fabulous job that Jackie and the team are doing out at Sefton Park in that space. So that's really the key things I want to talk about there around the current community services. The next thing I wanted to mention was around the GP respiratory clinics. Now, we know there's a number of GP respiratory clinics across the state, and they've been seeing around about 1,100 patients a week going through those locations. The advice we have at this stage is that those sites will sadly not be continuing, and that's based on the Commonwealth contracts they have in place. So this is really now thinking, how can we make care better for people to be able to access respiratory assessments? And we know a number of GP clinics have been setting up dedicated respiratory sites, have now been seeing patients post-negative RAT, utilising telehealth and trying to prioritise patients who do have respiratory symptoms. So the advice we have is a number of those sites will not be open over the Christmas period because those contracts end on the 31st of December, and therefore they'll be stopping operations to pack up. A couple of sites will be open between the Christmas and New Year period, not on the public holidays, and so we'll send out those dates the week before to everyone via the GP update. And of course, they'll be reflected through online booking services as well. So very sad to see those services finish. We've certainly here at SA Health, we've been funding a respiratory pathway through a number of those Commonwealth sites, and we have seen the absolute benefits in being able to provide services for patients outside of our emergency department. So sad to see that service cease, and we'll be looking forward to hearing some more advice from the Commonwealth about whether there'll be any other alternatives in place, particularly as we move into January. Now, the flu vaccine. I did say I was going to mention about the flu vaccine, and this came from a reminder that Kerry Chant did earlier in the week around the importance of getting a flu vaccine for our travellers going overseas and keeping up to date with other vaccines. And this comes off the back, we know we're already seeing influenza cases in the Northern Hemisphere, making sure that some patients are eligible, as per the immunisation handbook advice, are eligible for a second flu vaccine. And we know some GP clinics still have access and still have doses in their fridges. So if people are eligible, just keep in mind that you may get some people coming in for flu vaccines. There's just been a bit of a push to make sure people are fully up to date, both COVID with that 4th dose, if they're eligible or they haven't yet had it, and then making sure as well that we're offering flu vaccine for those who are eligible as their 2nd dose for Northern Hemisphere travel in particular. All people can get their flu vaccine when they're overseas, noting it's slightly different, usually modified based on the variants and what's happening overseas. Now, the next thing I wanted to flag, and I feel like I'm doing a lot of talking, but I must admit I didn't put a lot of time into my slides today. So I do have a few slides after this, but mainly just wanted to provide key updates and seek questions. We've only had one question in the Q&A box, so please encouraging people to please post any questions you have. Nothing is silly. I wanted to talk about the transition to the virtual care service. And what is the virtual care service? So we have 2 virtual care services here in the state. We have the Child and Adolescent Virtual Urgent Care Service operated by the Women's and Children's. And many of you would know that. It's got a large number of GPs who work for that service, which is fabulous to see. And it's operated via an online website that people enter in their details and therefore can then access the service. And what they do as part of that is they provide a virtual video assessment utilising the Health Direct platform, a video assessment for patients at home instead of coming into the emergency department. And they're seeing both COVID and non-COVID patients. And particularly important, we know if people can't get into their usual GP, that service is available, particularly if they're concerned and thinking about going into the ED, utilising that service. And then if necessary, can come in then and see one of the emergency doctors in at the Women's and Kids. And in some cases, they've been referring through to the priority care centres, the PCCs, as well at Hindmarsh and in the North. So keep in mind that service is available online. It's patient or consumer facing, so you don't need to provide a direct referral into that service. And then we have the Adult Virtual Care Service, which is down at Tonsley, and the Adult Urgent Virtual Care Service is providing services across for patients who call up SAS, for instance. They call up ambulance and they get a face-to-face assessment on site. Perhaps maybe they're at home, they're having some issues, they've potentially hurt their leg, for instance, or they're immobile. They don't need to go necessarily into an emergency department. They can have an emergency physician providing virtual care through the paramedic who's there on site. And that's what the VCS team are doing. But what they're doing from the 15th of December onwards is they are incorporating our COVID hub. So the work we've been doing that Jenni Gould's been leading, they're going to incorporate that into their VCS model. The VCS team have also been providing, and many of you have contacted us about this to have more info on related to what is this service, the residential aged care facility virtual service as well. And this is for patients whereby they're thinking about calling up an ambulance, potentially worried, maybe they're worried about a UTI in one of their residents. They can call up through the QR code to that service and are able then to be seen by one of the emergency physicians or one of the other specialists who work for that service. And we're very pleased that they are employing GPs into their service to be able to better support the needs of the aged care residents. So pleasing to hear that as well. So that's a little bit about what VCS does. And so we're delighted they're going to be absorbing different functions from our COVID care centre into that VCS model, which is good. Vaccine reminders, and I sort of touched on this a little bit with other vaccines, but COVID vaccines, a reminder that in fact they are still available at a number of GP clinics and through pharmacies, but we are then stepping back from our SA Health vaccine sites. And we do have the new Pfizer vaccine, the Omicron vaccine, coming out, I think it's on the 12th of December, and we'll send out more information soon on what that will involve. But essentially, if someone's eligible for that 4th dose, any vaccine, so they can either have the Moderna one or they can wait for the Pfizer, but we would advise they have it now and don't delay, particularly as we see these cases in the community. Finally, point number 5, testing changes. And this leads to why we've got Simon here today, which is fabulous. As many of you know, we had Tom Dodd come to a number of these webinars. And it's great being able to provide information on where the testing services are up to. But from the 9th of January, there will be a requirement for referral testing for COVID-19 PCR tests. And so Simon's going to talk a little bit through about how the iPath system works. And also that means then stepping back away from drive-through testing sites. At the moment, the community can access 5 free rat tests when they go and get their PCR. And I know a number of my family members who went and got PCR tests recently, thankfully negative. They were all handed out rats at the same time. So fabulous, 5 free rats can be given. And that means that people can keep these rats as they move into the next year, particularly then if they can't go and get that referral straight away with their GP, if they need to get a PCR test, they can utilise one of these free rats in the home. And finally, point number 7 I want to talk about in my marathon talking today is urgent care centres and priority care centres. We've been getting quite a number of inquiries again around what are urgent care centres, and particularly the fact there's been quite a lot of communication happening in the eastern states around setting up urgent care centres through primary health networks. So there's 2 models of urgent care centres. The first is the Commonwealth Medicare Urgent Care Centres, and these are national ones. We've got 5 here that have been announced in SA for next year to be set up, and these are being led through the Primary Health Network. We have no further details yet on these clinics. They're still working through the model of care, and they're not yet being advertised under an expression of interest model. So these are the Commonwealth national ones. We'll have 5 here in the state. These are not the same things as priority care centres. People will ask us, are they the same things? They're not the same things. They're a different model, a walk-in model that's been proposed by the Commonwealth that the state and the PHNs are very interested to make sure we get this model right, doesn't step on the toes of GPs, and it works complementary to our emergency departments and the primary care system. Now, you may have heard, well, what's this PHN advertised urgent care clinics interstate? These are different. These are state-funded urgent care clinics, and you may have heard of the Victorian ones, the PPCCs, the primary priority care clinics that are being operated across Victoria. They're setting up 35 of these before Christmas. Now, these clinics that the PHN are working very closely with the Victorian Department of Health are a different model, and they're complementary again to where they're operating their respiratory clinics and where Victoria is operating their virtual care service. So please try not to get too confused at this stage. We do not have any current expression of interest here in the state for urgent care models. When that model has been finalised, the PHN will be very strongly involved, and you'll be hearing more around what does this mean and how can you become involved. So we want to just provide a little update on that space. We have our priority care centres, the PCCs here in the state, GP referred, can be referred in by SAS, referred in by the virtual care service. Important we know, particularly around patients who do not need to come into an ED, but still require that urgent assessment within a 2-hour time frame, it can be seen within our priority care centres. So encouraging you, if you have a patient, consider referring them across to a PCC if you can't fit them into your GP practice, but it needs to be seen and does not require an emergency department visit. So I've run now through my mammoth list of 7 items. Just in terms of the slides, I just want to very quickly show you a few slides, if that's okay. And then I'll come to answering some of the questions and we'll move to Jenny. So the changes that we had, as I mentioned before, 5 free rats can be picked up from existing rat collection sites or the SA Pathology PCR sites. We know from the 23rd of November, there were changes that came in that lifted those public health restrictions, and it does now mean that it's not mandatory to report in a rapid antigen test, but please still encourage your patients to report those in. It's important for us to know where cases are, but also important then that patient is then registered in the system, which means we can then provide that care if they are in that high risk group. It means when they call up through to the National Coronavirus Helpline, we know who the patient is. We can look them up. We can see where they are because they reported their rat. We can then provide that healthcare to them. So important to emphasise to your patients to please report in their rat test results. And then finally, as I mentioned, around the changes that will come into effect on the 9th of January requiring a referral. So giving people plenty of time to be able to either see their GP in advance, to organise what their plan may be if they do develop symptoms, and also advising plenty of time for the community as well to make sure they've got rats at home if they need them. And as I mentioned, priority care centres, virtual care service and child adolescent virtual urgent care service as well. And of course, we will continue to send out this information through our weekly updates. Finally, you can see here just a couple of graphs I'll show on the screen here around cases per 100,000 population, showing us how we've increased those cases. Hopefully we're plateauing at that top bit now of cases, and then we'll hopefully see a decline leading into Christmas. And you can see here as well, mapped as well, where we've seen different changes of the variants. And a very big thank you to the individual who pulled these slides together for me around the graphs. So I just find it so interesting to see where SA sits in terms of the national numbers. And this was in relation now that we've moved to Friday reporting numbers. And finally, hospitalisation data. Helpful to see. We're seeing that really steep increase in the New South Wales numbers being reported, and SA still maintaining numbers in accordance with where we'd expect to see less than 1% of patients being admitted for COVID-19. And finally, an area that gets a lot of interest is around the variants. I have just pulled out this graph that we have circulated around here in SA Health. We were talking through recently around where we are seeing some of those changes happening in other countries. I think this is just such a good one to look at and see where we are seeing some of those different variants emerging, and particularly the percentages that we're seeing in other countries as well, that shift away from where we saw BA5 now moving towards the change that we see with different changes, particularly the Spain one I thought was quite interesting. And then finally, some of the analytical data from Central Adelaide Local Health Network, mapping out current cases, ICU occupancy, and those medium, low, high predictions that I share in these webinars with you. And finally, this was just based on feedback. We know that people are always interested to see the SA Path data around the current genomic picture here in the state, and we'll continue to talk through that and release media advice as required on these numbers, but certainly not seeing anything unexpected, inconsistent with the other states here in Australia. And that's all from me. We'll come now to Jenni Goold, and then we'll go through some of our Q&A for you today. So Jenni, I'll hand to you, and I think you're going to share slides from your end.
Lovely, thanks, Emily. Hoping this will. So welcome everyone, and nice to see you all. Well, not see you, but almost see you. I wanted to start by saying a huge thank you to all of the GPs in SA who've just been not only stepped up in this space, but have absolutely thrived in supporting our patients in the with COVID. So well done. I think we can all say when the GPs get going, they really excel. So just checking that everyone can see my screen, Emily.
Perfect, except Jenni, we can see your slide and your next slide.
Ah, that must be a setting thing.
Just click on the display settings there.
Yeah. Yeah, it's just on maximum slides. I'm not quite sure what I've done. Maybe Crystal, do you want to share it at your end in a different format? That might be easier.
Yep, no problem. I can share from my end.
Or shall I just keep going?
No, you can just keep going, Jenni. That's fine.
All right. So running through, we just thought we'd go through. Now we're doing the living with COVID and really move towards that business as usual model. So I just wanted to refresh and run through those ideas, and Emily's covered off on a lot of that stuff, which is fabulous. So have I got any slides sharing at the minute? No.
No.
Okay. So initially, first thing is to talk about the role of the GP. Prevention, and I think that's what we do really well, primary care. So vaccination, vaccination, vaccination. I mean, I think that message has been coming through loud and clear. I think the next step around that is really working out an action plan for high-risk patients. So working out who will be at risk and forward planning for that, and even thinking about having up-to-date renal and liver function tests if these patients are people who may well be eligible for antivirals. Need to think about having a plan in place in your practice for how patients will access, because we're all enormously busy in general practice land, and so finding acute appointments for patients to be squeezed in a busy schedule is difficult. But we know with COVID and antiviral treatment, we need to start that as soon as possible. So setting up a system when COVID patients, positive patients are contacting the rooms is really essential. Of course, there's the acute management, which is really supporting patients with their symptoms, antiviral prescribing, which is so important and also so time sensitive, and of course referring on to other services if that's required. So what are the referral options for GPs in the community? So we have the COVID high risk or community hub clinician advice line, which Emily has already spoken about. And we're here and we'd love to hear from you. We are continuing to run services 7 days, 8 till 8. Our phone lines are open. And as Emily said, this service will be winding up here in at the SA Health, but it will be being transferred onto the virtual care service. So for our community-based GPs and clinicians, you will have ongoing access moving forward, which is fabulous to hear. When you ring that number, and it is a number just for clinicians, not to be given out to patients, then you'll hear a brief recorded message and you choose option 2. If you're really busy or if we're really busy and don't answer straight away, then I suggest that you just leave your callback details and we can ring you back as needed. So what does the High Risk Hub do? I think we've covered this many times, but we receive referrals from a variety of places. So it's a combination of a fabulous team of nurses, admin, and our GPs who are all working together to coordinate care and support of our clinicians in the community. So we receive referrals through the COVID, the National Corona helpline and Health Direct. We also receive them from other places like ICCNet and ED, as well as the virtual care service at Tonsley. So we will service those patients who are referred to us, and we'll also provide support to clinicians in the community about how to manage their patients. So that might be, for us largely, that's around antiviral prescribing, and also referrals for face-to-face, and where to do that if ED is not the right place for that person, because there are many options. So what are those options for escalations? And Emily's already covered this fabulously, as always. So we have the respiratory clinics, which of course, yes, they're changing, winding up probably the end of the year, and some changing in their opening hours as we approach Christmas. But they have capacity at the moment, and so they're a great resource for busy GPs. We have, as you know, our COVID care centres have closed, and we have one fabulous one remaining, our Sefton Park COVID care centre, our hospital avoidance supported discharge service. So they run 7 days, 8:30 to 8:30, and they will continue to run throughout the holiday season, including Christmas Day. So they will be there. It's of course a referred service, so you need to be referring your patients in, so they can assist with all sorts of things that require face-to-face or investigations, as well as their fabulous role in remdesivir infusions for those who are eligible. They also during the week have a range of allied health services available as well. So that service is there and ready to be utilised. Of course, we talk about hospital avoidance, but really it's about appropriate use of the emergency department and our valuable ambulance service. So sometimes that is absolutely the right place to send a patient, and so that's what you need to do. There's also the MRU, which we're all very familiar with in community general practice, about services that can be provided to our patients on the ground in their own homes. Now, patients who are eligible for these services can still have these services if they become COVID positive. So that continuity of care will continue. I think we all know about the priority care centres, and they are not seeing COVID positive patients at this time. And the ICCNet services, which has been the remote monitoring system that has been available, will be taking their last COVID patients for monitoring on around the 14th of December, as per the GP liaison update that came out this week. That service will continue for regional and remote, and certainly in the new year, regional and remote GPs will have the opportunity to use it for monitoring for chronic conditions and other issues beyond COVID. So, but changing in the COVID space. We've got, of course, options for escalations in paediatrics. Emily's already talked about the CAVUX, or the Child and Adolescent Virtual Care Service, which is when the parent or the guardian logs in online and can organise a video consult. It's a great service. It's only available for children over 6 months of age, so not under 6 months, and it runs also 7 days a week, 9 till 9. It's best used in an acute setting for a one-off service. It's not really to replace GP, and with that continuity of care, just for when patients find themselves unable to get into a GP and in an acute situation. And then we have COVID Kids, which is particularly obviously relevant for COVID, and they will see children from 0 onwards, so they don't have a cut-off of under 6 months. And Emily's talked about our fabulous respiratory clinic. So I think nothing more needs to be said in that space. So the antiviral prescribing, which I wanted to really congratulate our South Australian clinicians. We have been doing extremely well when you look at the statistics, certainly in our over 70 age group. So well done. But we can always do better, and certainly in our under 70 age group, we can probably spend a little bit of time identifying those at risk and focusing on getting them access to antivirals, as well as in our aged care settings. These seem to be a more difficult space, and for lots of reasons which we all understand so well with aged care. So PBS eligibility has expanded, and so most people can access antivirals through the PBS if they're required. So we've got our immunocompromised group, anyone from over 18 with the who meet this criteria, and that's prescribed with the appropriate authority code I've listed there. We have our Aboriginal and Torres Strait Islander group who are over 30 with a risk factor. The risk factors are listed here in the box, but I'm not sure that you guys are seeing my slide, if Crystal's managed to share that. But they are outlined, and I think the one thing that that trips people up is when we're looking at cardiovascular risk. Hypertension alone is not considered a risk factor. So we are looking for coronary artery disease, heart failure, cardiomyopathies, other cardiovascular diseases. Hypertension alone is not one. And patients over 50 with 2 of these risk factors are also eligible through the PBS with the code 13156. And of course, patients over 70, where we've been doing so well in South Australia. So this covers an enormous group of eligible patients, but of course there are still some. So those who are under 50 with risk factors, or in our Aboriginal and Torres Strait Islander population who are under 30 with risk factors and not meeting PBS criteria, we still can access our antivirals via the National Medication Stockpile. So that's still through the referral form on the SA Health website, although it's changed slightly and it's now sent directly to the LHN involved rather than to a central sorting space. So really there is antivirals for those that need it. It's just finding them and getting them to them in the timely fashion. So how do we get onto the referral form? Well, shown here is the link to the website. So you Google SA Health COVID treatment referral, and it will come up with treatments and referrals for COVID-19 SA Health. So you click on that and it links you through to the how to access the form, which you then can complete and send in. As I said, you need to identify where you're going to send that patient. So whether that be, Saalan, Naarlen, or central. Sefton, who are our only COVID care service currently, have also expressed that, you know, they do at times get busy, and we've been helping them out in the hub, but it's really important that patients won't necessarily hear back straight away. They certainly will usually hear within a day or so, especially if someone's being referred at day 2 or 3 of their illness and we have a little bit of leeway. They will prioritise the patients that have you know, are closer to the end of that eligible time period. So what are our antiviral options? I think everyone's very, very familiar with these. So Paxlovid is our first line, second line, third line, fourth line. I think you're getting my point. Think about Paxlovid and how are you going to make that work for your patient? It is the most effective. And I do understand it is the most complicated, perhaps, when you look at it to prescribe, but there are some drug interactions, but a number of these can be managed by changing to alternatives, or some medications can certainly be held for that treatment period and the additional 4 days. So do not exclude Paxlovid just because you think there's a drug interaction. Remdesivir, of course, is our infusion, and that is the only option we have for pregnant women and is utilised in patients who are unable to take Paxlovid. And then it brings us to molnupiravir. So if you're thinking about molnupiravir and about to pick up your script pad and start writing, think again, go back and see how you can make Paxlovid work in this space, or remdesivir, because we know molnupiravir is much less efficient and effective, and we really want to be getting these people we've identified as high risk the best treatment possible. So I think I've laboured that point. So Paxlovid, I think we all know we've got to start it within 5 days. It's 3 tablets twice a day. It does have drug interactions, so check out the Liverpool drug interaction checker, which you can download as an app on your phone, or you can use UpToDate, or you can certainly reach out to the fabulous Dardis, who are happy to still provide support in this space. It does have some side effects and some contraindications. It's hard sometimes to tell the side effects from the COVID illness itself, and we need to think about contraception. But the really, really good news, hot off the press, is that Paxlovid can now be halved or crushed. The tablets are big, and that has been difficult for some patients. So that's really good news. It makes it even more accessible for patients. Remdesivir, as we know, is an infusion given over a couple of hours for 3 consecutive days. It usually gets the first dose given in at Sefton, and then the subsequent couple of doses can be given to patients in the home if it's been successful. So this is a fabulous service. Is of course the only option for our pregnant patients. Pregnant patients cannot get their remdesivir at the Sefton COVID Care Centre. They need to go to their birthing hospital, and it needs to be managed there as an outpatient. And each of the hospitals have their own COVID plans and management pathways for dealing with this. It has a few contraindications. It's mostly around the bradycardia and the drug interactions. There's a few, but much, much less than with Paxlovid. So thinking about beta blockers, verapamil, chloroquine, etc. Those CYP3A4 inducers. Molnupiravir. We're here again. So if you get here, as I said, go back and rethink about your Paxlovid. But again, it's 4 capsules twice a day for 5 days. There's a few contraindications like pregnancy and breastfeeding, bariatric surgery because of absorption, and if you've got an allergy, can't be given to those under 18. It has no significant drug interactions, which is why I understand it's so appealing. And it does have some side effects, and we need to think about contraception in our males who could potentially get their female partners pregnant, they need to use barrier contraception for 3 months, and our females for the duration of the course. So molnupiravir, less impressive in this space. Some of these medications, such as Paxlovid and remdesivir, will need some recent renal functions or liver function tests. So as I said, if we've identified those patients in our patient populations, we can ensure that's happened, but otherwise we've got great domiciliary services, and these are very prompt and efficient. So we've got SA Pathology domiciliary service and ClinPath. So you contact them, and for in my experience, it really often happens later that day. They're very prompt to address those services. So don't let that put you off prescribing, because you can certainly get blood tests done if required. You can certainly start someone on their Paxlovid, and if you think their renal function is very likely to be okay, there's had previous ones and there's been no acute events or anything to suggest their renal function would have deteriorated, and if you're worried, get a blood test done in the next day or two, and if there was an issue there, you can then reduce the dose for the rest of the course. So as I say, that's not that's a very easily overcomable hurdle.
Oh, Jenny, I would add to that as well. We had a great catch up with ClinPath earlier in the week around what they're doing for bloods as well for patients, particularly who need it for antivirals. And as Jenny put up on the slide, really important, you know, that there is the domiciliary service available for both SA Path and ClinPath to be able to undertake the blood test, but ClinPath are also enabling their sites that are standalone testing sites to be able to not only do PCRs in their clinics that are standalone, but also to do the blood test currently for COVID positive patients in their sites as well. So just keep that in mind. That's not for ones where they're within another facility, but standalone sites. And we will send out some information in the next week or so across all three providers, so SA Path, ClinPath and ACL, what they're all up to in this space, just to provide more options for quicker turnaround for pathology. Thanks, Jenny.
Excellent. Yes, good points. So our pregnant patients, so I'll put on my obstetric shared care hat and my COVID hat in this space. So if you're not sure, obviously contact the hospital where they're booked to birth, or if they're early on and haven't yet booked in, that they will be zoned to birth at. Because the 3 birthing hospitals now have their own, are responsible for their own COVID patients. We are no longer using Flinders as the centre of all things obstetrics and COVID, and all hospitals will have their own pathways for these women. So I think we need to think about our pregnant women from the perspective of disease modifying treatment assessment. So again, as with our non-pregnant patients, if they're immunocompromised, they're eligible, and if they're not fully up to date with their vaccinations and they have risk factors, which are also listed here, with diabetes, of course, obesity, other chronic conditions, that would make them eligible. So these patients, if they are eligible for disease modifying treatment, of course, this is remdesivir given as an infusion on 3 consecutive days and would be done at the hospital they are birthing at. So the other thing we need to think about in this obstetric space for pregnant women who get COVID, and in that 6 weeks postpartum, remembering that's just as important if they get COVID, is to think about VTE prophylaxis. So we need to, if you're COVID positive, but it's a very mild disease without needing hospitalisation, and the woman has no other risk factors, then they're not requiring VTE prophylaxis. But we need to talk to them about remaining hydrated and keeping moving, obviously. I mean, not jogging necessarily, but not spending a week in bed. But we do need to think about VTE prophylaxis in those pregnant women and postpartum women who've previously had clots, or if they're over 35, that magical age in pregnancy, it seems, if they have a well-padded BMI that I can relate to, over 30, with another risk factor or over 40. If it's an IVF pregnancy, if they've got known clotting disorders, smoking, multiple pregnancy, if they've got had preeclampsia or at risk in this pregnancy. We've talked about immobility and those who've had more than 3 children before. So that they're the group that we should be thinking about. Now, there is a fabulous way to score them on this sheet, and if you Google COVID and pregnancy, the document around this comes up, and it has the criteria, and it is all dependent on what trimester women are in, under 28 weeks, and then 3rd trimester, and of course postpartum, and you give them a score, and that will determine if they need VTE prophylaxis. And the dose of Clexane is weight dependent, so you will need to check their weight, and they would be given the VTE prophylaxis, the Clexane, to administer for 14 days. So you can write a script for that can get delivered, or someone can pick them up from the pharmacy, and there's fabulous online videos about how to inject. But again, if you need some help with that, MRU or your birthing hospital should be able to help you. So I think, as Emily has said, moving forward, we the COVID Community Hub will be transitioning over to the virtual care service, but you'll have continuity of care for that clinician support line. And of course, our fabulous Sefton Park hospital avoidance service will remain open throughout the Christmas and public holidays as their usual hours, and will be cornerstone for care in this COVID environment. The National Corona Helpline will be continuing. Of course, our GPs, you guys out there, have ongoing access to telehealth, so you can provide safe, non-face-to-face care for these COVID patients regarding symptoms, and of course, a very important antiviral prescribing. And we've talked about the respiratory clinics that will wind up by the end of the year, but perhaps their services will shut before then. So I think that's really the end of what I had to say. Sorry about my PowerPointing, but I did want to use this opportunity to say what an amazing experience it's been to be involved in this space over the last couple of years. And I wanted to thank my COVID GP team and those who've supported us, absolutely. But I wanted to thank you GPs out in the community, because you know, this was something we'd never heard of, and you've stepped up and provided essential care in this space and keeping our South Australian community safe. So enjoy the festive season. Remember, we will be here, and the COVID Care Centre will be here, and I wish you all the best.
Thank you, Jenny. And I think we got through most of your slides, which was fabulous. Okay, I'm going to now hand over to Simon to give us a bit of an update on where things are at from the SA Path perspective with the changes and with IPATH. Thank you, Simon.
No worries, thanks, Emily. Apologies, I can't go on camera. I'm on my laptop, and the good timing, the video is not working, but I should be able to share my screen, so just bear with me. So I was just asked to give a little bit of a run through on IPATH, on what it is, what it can do, and particularly how we can order respiratory samples through it from your clinics. So IPATH is our web-based platform. It was designed many years ago. I'm sure a lot of you are familiar with it or have at least heard of it. Sorry, is my screen sharing? Am I on?
Yeah, Simon, I can't see your screen.
No, okay, why is that? Yeah, there we go.
Perfect, thank you.
Brilliant. So yeah, a lot of you will be familiar with it or at least heard of it. It's a web-based, or was designed as a web-based result delivery platform that allowed access to, originally 5 or 6 years ago, it was only patients that you had referred testing for. More recently, we've actually opened it up to allow testing, to allow access, sorry, to patients that we have access to. Sorry, I'm having real trouble here with my screen. There it is. Access to all patients. So in terms of accessing it, it's actually quite easy. You just jump onto our website. There is a little icon there that says iPath. You click into it, and I will show you a very quick demonstration of that after we've just gone through a couple of slides. But it's on any web-enabled device. You don't need to be behind the network, SA Health network, and you don't need to be at a PC. So it is enabled for iPhones and tablets and other things. So to get access, if you ever do want it, please give us a call through our call centre, or even just send us an email. My team will pick that up and can set it up. It's very, very simple. We'll just need an email and a phone number, and we can give you access to all those results. The benefits of it, and more recently we've updated the functionality to be able to order respiratory testing, and I will take you through that. You can also search, as I said before, for all your patient results and any result that we have, SA Pathology have in our system, which is, as you'd all be aware, nearly all of the SA public hospitals and lots more. So you will get all those results now available to you. Ordering is very, very easy. Select the respiratory request in the taskbar, add a new request, put in your details. Now that is optimized now that if you've logged in as a general practitioner or as any clinician, that will automatically be filled with your details. When I show you in a second, I won't, because I don't have a provider number. I'll have to pick a doctor, but you can pick a different doctor if required. Not that I think that would happen often. Select find patient. So you find your patient, enter in their details. We do have some clinical info in there as well, particularly around, symptomatic, asymptomatic, and other bits and pieces. There's also a free text field, so you can add in any other pertinent information that you believe is necessary. There it is. Select refer, and that'll drop into our system. So at the moment, you can go to any SA Pathology collection site or COVID collection site. So that's any of our drive-throughs or walk-in clinics in the regions. And we can pick those requests up, which is obviously quite useful. Moving forward, post January 8th, we'll be able to pick that up in any collection centre that will do respiratory testing. We're currently in a process of just auditing all our sites to work through exactly which ones will be doing it and won't be doing it. Likely, and Emily touched on it before with one of the other providers, it'll be mainly our standalone collection centres, the ones that aren't co-located in general practice. But we will be able to pick up those requests like that, which will mean that the patient won't have to have a request form. So what I might do just very quickly is take you through just a request, how we would do it in the real world, because it's that quick and easy. Can you see the screen's changed?
Yeah, that's great. Thanks.
Great. So on our homepage, that's iPath. You drop in iPath results, click it. I've already signed in, but you will be asked for your email and password. This is the page that you land on. If you do want to look at results, I'll very quickly go through. I'll use my name as an example. Type it in. There are all the patients you can click on and go through all those results, which I won't do now for obvious reasons, but you can do that. Just keep in mind to click the All Patients tab. If they're just your patients that you're looking for, then filter by your patients. That's not a problem either, but All Patients is that one that's opening up to have Oasis-like access, if you like, of all the patients that are in our system that are available. Respiratory requests is up there. We click on it and we add a new request. I'm going to use Morgan as my doctor, but yours would already be populated for yourselves. So I'll just use Morgan there at Flinders. Test requested. We do have the option for COVID-only screening. Generally, the 12-plex will be requested. So that's COVID plus another 11 target pathogens. And then you can type in a copy. So if you do need that to go anywhere else, it can happen. We will pick that up manually at this stage, but please put in as many clinicians that you need the result to go to. I'll make this one urgent just for the sake of it. If I'm going to search for a patient, use my name again. There I am. We pick it up and then it goes down into that screen with all of the info. So it's obviously picked up the information that it has. You can add in Medicare numbers if you like. we'll probably pick that up anyway down the track, but we do encourage you to add a Medicare number. Any of those details there, you can see there's a few, I guess we've already populated for you. So you can say symptomatic, fever, fatigue, tell us when that all started. That will all populate into our LIS and any clinical notes that you'd like as well. And then we can create a request, which will drop into our system. I won't do that now because it will actually create a request for Morgan and she might get grumpy with me. But that's as easy, that's how quick and easy it is. So I think that's probably it from my perspective. Emily, did you want me to touch on anything else or?
I don't think so, unless there's particular questions that people had that they wanted to post in the chat. I think probably the key point we really want to get across is this is really quite easy to do. And there's the ability to be able to do this right now, be able to put in the request forms. And I think we're just trying to get that information out to everyone. This is available. You can do both the PCR for COVID, but also for the 12 panel, because we know there are so many, and I didn't actually share the slides today, but there are so many other viruses out there currently in the community, still seeing lots of RSV circulating. So really mindful, particularly if you've got a patient, they've come back with a negative COVID test, or perhaps they've done a rat test, they're not feeling so great, you decide to get the swab undertaken, you can order that through the online system as well. So I think that's just an area we wanted to flag with everyone. But if there are any questions at all that people had specifically for Simon, let us know. And if you're watching this afterwards, we know most of our views are post in the recorded phase, although it's difficult to speed me up to 2 times speed. We will send that through to you, Simon, and we can then post that into our next. We're going to do a dedicated pathology update for all primary care providers. We just feel this is such an area we want to get everyone on board, so it's really clear before Christmas. And you touched on it briefly as well around location. So we're hoping, Simon, once you've got your location set, we can send that out as well out to all providers, so they know which sites will test for, do the PCR swabbing, and which sites will also do pathology for phlebotomy as well.
Yeah, sure. So we are, as I said, we're undertaking an audit. We've got obviously 110 sites across the state, so we are doing that as quickly as possible. We should have that very, very quickly. I would suggest generally it's going to be our standalone sites, but we'll get a comprehensive list and happy to answer any questions. It's probably worth saying as well, your patients will get a SMS with the COVID result. That will continue, so we are going to be sending that out. The other 11 targets we won't, so the results will go directly to however you receive results now, whether that's through iPath or your GP software or other mechanisms. So that hasn't changed, I guess, is probably important just to let everyone know.
Thank you. We have had a question come through. Fabulous. Thank you. Around if you have had a patient referred in, they've had a PCR undertaken for COVID at one of the drive-through locations, and then you go, right, it's come back negative, they're still not that well, you want to order on a viral respiratory panel. Can that be done by iPath, or do we still need to call up to SA Path and add the test on?
At this stage, add-ons do still need to go through our call centre, so they are very, very aware of the need to do that, and I'm hoping I actually fall under my area, so I'm hoping that you are not held up for that. We've got dedicated staff actually there for those add-ons, but no, at this stage, iPath won't do an add-on. It is coming, but I don't think it'll be there for the 9th of January. But it should be quite seamless still. The other way you can add on as well that's really worth knowing is you can email through to that call centre. Now, I know most of you would have that email because you probably have used it for results and for other bits and pieces. We do get a lot of engagement through that email. So more than happy to pick up an add-on, particularly if it's not an urgent one, and likely the respiratory testing won't be hugely urgent, but it will be done within a few hours, if you like, as opposed to at the time if you call. So it is that is another option for you as well, that you don't need to pick the phone up if you don't need.
Excellent, thank you. So we'll add that into our path update. And I did want to flag as well, we get a bit of feedback around self-collected swabs as well, noting that we've got CleanPath doing self-collected swabs, whereby it's quite easy then for patients to come in and pick up the request form from the GP clinic. And I just want to flag, I know, Simon, that you're looking at this as well through the SA Path, still a little bit away, but I wanted to flag that as well with people, that everyone is continuing to look at different ways that we can provide PCR testing for individuals across the state. I think question posted in the chat around what do you do if a GP doesn't do a COVID swab and there's no other GP in the area. I mean, we can certainly, from the SA Health perspective, if it's around concerns around infection control or PPE, we can try and help work through some of those issues. But if it's around the self-collected, that may be an option in the future, and I understand it's being put through, Simon.
Yeah, it is. So 9th of Jan, we will have a self-collect, and hopefully earlier, to be honest, but certainly by 9th of Jan, we will have a self-collect option. We will make that available to, again, we are wanting that to be clinician referred or need it to be clinician referred for a number of reasons. But what we can do is provide your medical practice with those self-collect kits if you want, but also our collection sites, our dedicated or not dedicated, but our sites that will be collecting respiratory samples will also have those kits on hand. So if that form gets to the patient, whether it's emailed or I know there's other mechanisms, faxed even, for that people use, or the patient comes and picks a form up, as long as they show us that form, we'll give them a self-collect kit, and they can either do it there and then if they like and drop it with one of our collection sites, or go home and do it, or however they need to, however you advise them to do it. But we are working that up for the 9th of Jan, and we will make sure that they are readily available for people so that they're not hard to get hold of. Excellent,
thank you. That's excellent. And we did raise as well, for those who were worried about the healthcare worker collection service, we have had that is likely going to remain. So my pajama drop-offs of late night swabs to Coral Road will be able to continue. So that's what I just thought I'd provide that advice for those worried that we might see a change, but of course that will still need to be referred in, provider number referred in. But I want to flag that as well. Fabulous. Okay. Now, if we don't have any other questions, we just had one about the email, which I'll just add in, which I think is your call center email, Simon. Would I be correct? Is what you just said. So I'll just put that now into that question there in the chat. So that's available. I've just sent that through. We will leave it there then for today. And I want to say a very big thank you to our guest presenters, to Dr. Jenni Goold, as Jenni mentioned, has been absolutely critical in how this state has managed the COVID response and has been a phenomenal leader of the GPs within SA Health, but also in previous iterations of our high-risk team. So very grateful to Jenni's ongoing support in this space. And a big thank you as well to Simon for presenting today from SA Pathology around the iPath system and future developments. And final thank you to Crystal from Adelaide PHN and all the team at the PHN who are continuing to support us in this space. We're incredibly grateful. We meet with the PHN every week and see what's happening, what we can do to work together, and we're incredibly supportive from their end around how we manage COVID in a more sustainable way, but also supporting GPs and the community. So thank you to the PHN. And we shall leave it there and let everyone get on with their Thursday and hopefully get some sunshine in. Thanks, everyone.
Thanks, everyone. Have a good afternoon.